Welcome, everyone, and thanks for joining us on a Friday afternoon. We'll just give folks a minute or two to join and get started at the top of the hour. All right, Jonita joining us from Uganda. Thanks for joining.
Ways.
All right, so we've still got folks trickling in, but I think I'll just start with a quick look here at just a couple housekeeping items while folks log on. So first, just to note that we will have a Q&A portion of this for this webinar at the end of the webinar after we've each had a chance to speak. And we certainly invite your questions. I think we've got a lot to talk about here. There is a Q&A feature in Zoom that we hope you'll use that lets us keep track of the questions and any answers that might have been typed in that helps us, compile a list at the end and make that available. So certainly you can either just type your question into the Q&A feature, or you can raise your hand, and we will unmute you and let you fire away with your question. Other than that, just a couple reminders about Zoom. So the slides and recording will be available after the fact. Don't feel like you need to write anything down. There's a little bit of information there about accessing the audio. And just to note that the Zoom chat function, will be used for technical issues. Also, it looks like folks are getting a head start on introducing themselves and where they're from, so that's great. But for our purposes, we won't be looking for the questions there. We'll be looking for them in the Q&A feature. Something to note. Okay, and I see that we're at 2:02 here, and it looks like our attendance is stabilized somewhat, so I will kick us off here. All right. Well, first again, thank you everyone for joining us today, especially on a Friday afternoon. I'm honestly really excited to be able to share this conversation with you all. So today you'll hear from a few different folks. You'll hear from Lee Binder, Leapfrog's president and CEO, Dr. Osagi Ibekosian from the American Diabetes Association, their chief quality officer, Chris Lewak with Shore Medical Center. So she's not only a Leapfrog certified coach, but also leads a quality program and a 2025 recognized leader. And for myself, a little bit about the program. So just quickly to level set the conversation we're hoping to accomplish today, we want to walk you through just a few things. So first is how the program works, which is really important, why it's important to Leapfrog and ADA, why it's been such a priority for both organizations and how it's kind of worked out so far. So that means, really understanding why Leapfrog and ADA partnered to focus on this aspect of quality of care, how the ADA guidelines play such a crucial role in patient safety. And then we want to bring in some key insights from recognized leaders, from the past couple of years of the program, on her hospital's journey to actually earning the recognition. And then we'll talk a little bit about the specifics on the recognition and how you might go about applying, with your own sites. All right, and with that, I will turn it over to Leah to walk us through the partnership.
Great. Thank you, John. And thank you for your leadership on this program. It's been really exceptionally successful. And I thank you for for your leadership. And it is an absolute honor to work with Dr. Ebikosian and all of the team at ADA. This is a very important program, and I personally have learned a great deal about diabetes and the challenges of inpatient care of patients living with diabetes. It has been a learning journey, I think, for all of us. So I appreciate that opportunity from ADA. Next slide. So I wanted to give you an overview quickly of what Leapfrog is, so you know sort of how this fits into our purpose in the world. So Leapfrog rates hospitals and ambulatory surgery centers, but for this program we focus on hospitals, inpatient general hospitals, and we rate them on safety, in particular patient safety. We focus on a number of factors that are of importance to our core constituency, which are employers and other purchasers of health benefits. Those are the folks who founded Leapfrog and still remain our key constituent. Thousands of employers are involved with Leapfrog, asking hospitals to voluntarily provide information to us on their safety and quality, and using that data to inform their employees and their health benefits programs. It is just very important that their employees are getting excellent care and that the community of hospitals and health systems are transparent. That is just a fundamental principle of Leapfrog and of the employers who are involved with us. So transparency is something we are getting, luckily, from a significant percentage of the hospital industry, to their credit. They are not required to report to Leapfrog, but they do so. 80% of hospital beds are represented in our survey, and we are actually just very pleased to see this from the hospital industry. Again, they're not required to do it, but they do it, and they do it on behalf of their patients and to, I think, address the needs of employers who are also very pleased to see this level of transparency. So Leapfrog is looking at a number of factors that we can't get from any other source. So in patient safety, we're looking at rights and ethics, like billing ethics, make sure that patients are getting the information that they need when they enter the hospital to find out what their bill is going to cost. They're getting information that they should have at all stages of the billing payment process. We look at patient harm, medication safety, which is the most common error made in a hospital. We have excellent measures of medication safety. And we also look at healthcare associated infections. And we have data that comes from the CDC, but it comes in earlier than CMS reports it. So hospitals are able to get that information out to the public faster through Leapfrog. We have a number of measures around pediatrics, maternity care, and critical care. These are critical issues to all of us. It's just as family members, but also to employers and our constituents. And then finally, we look at surgical safety issues, including outpatient surgery. Next slide. The way that we rate hospitals through the survey is we offer an assessment on a cell phone scale, kind of 1, 2, 3, or 4 bars, on whether a hospital meets our standard. So Leapfrog, on behalf of our employers, is a very high standard. We're not a regulatory body. We're not saying this is the bottom line. This is how you provide okay enough care. That's not what we're interested in. We want to know which hospitals are providing excellent care, and when they meet our standards, to providing excellent care in that area. No hospital is perfect, but it is to their credit that they're publicly reporting, and they're trying. Just by being part of this, they are definitely demonstrating an effort to be excellent. So you can see on this screenshot an example, but you can look up any hospital for free always on Leapfrog and see for yourself how your local hospitals are doing. But this is a hospital that on our nursing and bedside care for patients standard fully met, meaning 4 bars, they fully met it, and it's excellent performance. Excellence is important to us. Next slide, please. We also have another program which I think is probably more prominent than the survey, which is the hospital safety grade. That's where we issue a letter grade, an A, B, C, D, or F to every general hospital in the country. Most of them report to our survey, some don't. They still get a letter grade because most of the measures in the letter grade, there are 32 of them, most of them are based on CMS data. So data that hospitals are already providing, we get from CMS on their safety record. And it looks at 32 measures that include outcomes such as infections and complications, as well as processes. Does the hospital have in place what they should to prevent the most common errors? And you, again, can look up hospitalsafetygrade.org. Everything on Leapfrog is always free to dig in and see how we got to that grade, how they did on all those 32 measures. We are fully transparent, and we really do urge people to take a look. You may not agree with our assessment of the grade. That's great. That's why we have all the information at your fingertips, so you can decide for yourself, but also for hospitals, because we find that hospitals have embraced the safety grade in, I think, a very productive way, and have used it to report to their boards and committees, to engage and excite their own clinicians and their own staff, and to get excited about how we might achieve that A, or how we did get that A, how we what we need to do better next time. I mean, we've been really excited to see the many really innovative and productive ways that hospitals have used this to improve. And some of the stories are just outstanding. So we are glad that it's useful to them, but it's also, of course, extremely useful to consumers. Next slide. Here's an example of an A hospital. We update the grades every 6 months. So we want to have the latest possible data available to the public based on whatever we can get our hands on that's part of CMS, and that our expert panel that oversees this and advises us on all aspects of the content of this grade. We want to make sure that you have as much information as our experts have as a consumer. And you can see we also have gas gauges. That's another way we try to show you how the hospital does on each one of those 32 measures, whether they're above the national average, below the national average, or right in the middle. Next slide. And this is where we get very excited about what we're able to, where we're able to see progress. And that is when we're able to congratulate hospitals that do well. For a very long time, one of the unintended consequences, many unintended consequences of fee-for-service medicine, is that everybody's treated the same. You get paid the same no matter what. Whether you get the outcomes for your patients or not, you get paid the same. And that means that everybody who works there just feels like they're just trotting along, and there's no difference no matter how hard they work, or how much they do, or how good a job they do. There's no pat on the back. It comes from the public you serve. So it's been a real strong part of Leapfrog's mission that we are going to make sure that when people do a good job, they know it. They hear it from the public, they hear it from the business community, and they can celebrate it internally themselves and recognize it. So here's some hospitals enjoying their A status, and their status as a recognized leader in caring for people living with diabetes, what we're talking about today. So this is an opportunity to really recognize hospitals for this excellence. Next slide. So as I mentioned, it's been a learning experience for us at Leapfrog to realize just how serious an issue this is in the inpatient setting. I will say that I've been in healthcare a long time. I certainly understood that diabetes was a major issue in general, but I thought of it as an outpatient issue, or a physician practice issue, or continuity of care issue, chronic disease issue, which it's all those things. It's also an issue at the inpatient setting, and a very serious one, because obviously, I should have realized this myself, when you are living with diabetes, you do not check your diabetes at the door when you're admitted to the hospital. You still have it, and it's all the risks that come with it, which are very severe, probably heightened because you are in a vulnerable state as an inpatient. So 8 million admitted to the hospital each year. It is really important that hospitals are able to follow the guidelines that ADA has outlined with such care and with such evidence base, and begin to truly be able to really protect those patients from harm, and also make sure that they're getting the best possible experience in their stay. I know ADA has published updated standards of care this year and continues to do so, has world experts involved in developing those standards, which we appreciate so much. So regardless of whether you as a hospital want to apply to be a recognized leader this year, we do hope you study those standards, because these are important to your patients. And CMS also has begun to implement a new electronic measurement on severe hyper and hypoglycemia. They're not yet publicly reported, but they will be soon, and I'm sure you're all paying attention to that as well. Becoming a recognized leader is a good pathway to doing pretty well on that standard. So next slide. So we've been very happy with the progress of this program. It's brand new. It's really just 2 years old now, which really is brand new. And we've seen a 25% increase in applicants last year, double the number of recognized leaders. So more hospitals that applied for this recognition qualified for it, which tells us that hospitals are really paying attention to these guidelines and are able to achieve this designation as a result. And that they're more interested in the designation suggests that there's just more interest overall and awareness of these important guidelines. So that is just for us, very gratifying to see. And then we know that people are affected by this. So I just want to go back and say, even if you're not ready to apply for this, don't want to, that's fine, but please pay attention to the guidelines, because it's affecting 500,000 inpatients. Even just those of the recognized leaders are now affected because these recognized leaders have put this special attention to the care of their patients with their inpatients with diabetes. 500,000 inpatients are now impacted. So even just among the applicants who must be paying attention, or they certainly wouldn't be applying for this, we believe that that's going to affect over 1 million patients with diabetes each year. And certainly, or over 1 million inpatients, and certainly a 250,000 with diabetes. So we just feel very strongly that human lives are being impacted by this program. So we are full speed ahead to make sure that we can continue to reach out to even more hospitals that can make a real difference in the lives of these very vulnerable patients. Next slide. When you become a recognized leader, you get some attention. We've had a lot of attention from the healthcare press in particular, but also some of the business press, because as I said, we're a employer-driven organization. We've been very happy with that. I think a lot of the recognized leaders have also gotten local attention for this. Again, all coming back to this notion that people who work so hard in a hospital to achieve these levels, these outcomes, and do so voluntarily and really care so deeply about their patients, that they're willing to put this kind of effort into a program like this, really deserve to be recognized for it in their community. And we're seeing that with this program, and that's been also very gratifying for us. Next slide. Here's the list of recognized leaders from 2024, in red, 2025 in blue, and then both years are in green. And we'll give you I'm sure you can get a hold of this slide from us, and the list is on our website. But congratulations, if any of you are on right now. I know Chris, we're going to hear from Chris Lewak. Congratulations to all of you, and thank you for doing this for your patients, because it really means a great deal to all of us. Next slide. And with that, I believe I am introducing my wonderful friend and colleague, Dr. Ebakosian.
Thank you so much for your leadership, Leah, and it has been ADA's true honor to collaborate and partner with a trusted leader in patient safety like the Leapfrog Group. So it's with a lot of joy that we're happy we're going on this journey together, because ADA brings strength around developing the standards and interpreting the standards, and Leapfrog, you all bring your strength around patient safety and understanding how to measure patient safety. So this has been a wonderful union, and we're truly grateful for that. I will, for the next few minutes, share on what exactly are these standards. But before I even get into that point, speak a little bit about why this is important to ADA, the American Diabetes Association, and how this fits into our strategic priorities as well. We can move on to the next slide. So what I share here, it's the strategy map for the American Diabetes Association, ADA, for the next 3 years. These are priorities. It's a little hard to read, but I'll highlight a few things on this slide. The first is our mission. Part of our mission is truly to improve the lives of everyone impacted by diabetes. And personally, I have family members too that are impacted by diabetes. So, and I'm sure a few of us on the call, on the webinar as well, may also have personal connections to diabetes. So we know of people in our community, people in our neighborhoods, people in our family impacted by diabetes. So at ADA, we wake up every day thinking and dreaming on how do we make lives better? How do we also support ongoing management of diabetes in the inpatient setting, in the outpatient setting as well, and also in the community. I also want to highlight in the section of the what's, we spend a lot of money every year supporting research, groundbreaking research. ADA spends over 20 million a year on supporting research in diabetes, both in the US, but also globally. Some of this research leads to how we come up with the standards and the insight that makes it into the standard. So I share that to emphasize that the recommendations and being made in the standards are supported by ADA research, but also research being done by many thought leaders across the world on how should we care for patients with diabetes in the hospital setting and a host of other things as well. It is involved in advocacy. We advocate for patients with diabetes on the state level, on the federal level, in the community level. Education, that's a big component of what we do. And then finally, Connect and the Connect pillar, which this program fits into. We're constantly trying to improve access and improve resources for communities living with diabetes. And we see the big need to connect patients living with diabetes to hospital systems that are prioritizing patient safety around inpatient management of diabetes. We see the need to connect hospital systems and patients to great resources as it relates to supporting a culture of improvement, a culture of patient safety as well. And under the focus aspect, diabetes management, it's a key focus area for us at AD and Health Equity, like Leah talked about. We also see the how this program fits into our agenda to ensure that everyone has a chance to have the best optimal outcome wherever they are admitted if they're living with diabetes. So that's our strategy map, and that just a few examples of why we're so excited to collaborate and partner with the Leapfrog group on this. Can move on to the next slide, please. And on the quality lens, there are key objectives the ADA is working on, and I won't go through all of these, but I'll highlight 2 things. The first objective around promoting a culture of quality across specialty organizations, across hospital setting. And the third objective there, to equip health professionals with the tools and knowledge to deliver quality care. Our partnership with Leapfrog and in the inpatient setting and inpatient safety helps very critically with those 2 objectives, but also the others. Because with this and hospital system making the effort to go through the survey and go through the application process and submit our data and work with the local teams to improve their culture there, and also some of the resources too available from the Leapfrog group, from ADA. Those are all components that we're trying to get at as well with this collaboration. And so if you're a health system thinking about this, I think that's another sort of potential benefit there. It's the process will help with connecting you to tools and resources in terms of answering some of the questions and exploring what policies you have, what policies you don't have. But also the process will help too as you think about what's the local culture in your system and patient safety culture and an improvement culture as well, and which are all fits into the national goals that the ADA is working on in the health system. We can move on to the next slide. So Leah talked a lot about the standards. AD has been in the business of creating standards of care for diabetes for the past 35 years. ADA as an organization, we've been in existence for 85 years. 35 of those 85 years, we've been developing standards through a very rigorous process. It takes a year to update. Every year, the standards are updated. Specifically, as standards of care in the inpatient setting in the hospital, it's a whole chapter in the standards of care documents, and my colleague has put that in the chat if you want to read more about it. And we welcome you, like Leah emphasized in our portion too as well, to read about the standards. The standards cover a wide array of recommendations on, what should happen in the hospital setting, what should happen as it relates to managing low blood sugars, high blood sugars, when there's variability in the glucose in glucose levels, and a host of other things as well covered in here. And so it's a very comprehensive document, and what we've done with the Leapfrog group is take this comprehensive document and put that into an easy to understand application and survey process that captures the core element of meeting those recommendations. So you can be rest assured that by meeting and this standard, you'll meet this standard by meeting the recommendations set out to as part of the program that we're discussing today, the recognized leader and caring for people with diabetes. So that's what the standards are, and this program helps in ensuring that your health system or the hospital you're working with can adhere to these recommendations, that there's a robust evidence that's going to developing them, updating them, and making sure that we all know that by implementing this, we can see a direct impact on outcomes for people living with diabetes when they're admitted in the inpatient setting. We can move on to the next slide. And yeah, I just want to highlight that, and as part of that chapter, there are a lot of different tools and resources. So in the figure here, there are different algorithms, different workflows. What's critical and important is, as you are preparing, if you do decide to go through this program, and as you're preparing for that, we recommend and we encourage you to go back to the standard and reference them as you're thinking about what should the policy look like, what should the process look like, what are others doing, and there are a lot of references to as well as part of this chapter, and it's a great tool. And the standard itself, but more importantly, the application encourages you and the team to think about different components that should become a part of routine inpatient management in your hospital system. So that's the key message I'm trying to highlight with this slide. You can move on to the next, please. But we want to go beyond the standards, which is why we're excited about our partnership with Leapfrog Group. The standards are one thing, it's a great resource. We've been working on that for 35 years. We update it every year. So the second week of December, there will be the 2026 standards that will be updated to match where the field and the research and science are evolving. But we want to go from just the standards of care to it becoming standards of practice. Our partnership and collaboration with the Leapfrog Group helps us to do that collaboratively. But I know that many of you on the call will also share that same sentiment on how do I take these standards and make it routine. And this program helps with that journey. So what we're doing holistically at ADA, we took this inpatient standards, work with the Leapfrog Group to think about where are those gaps in implementing the standards and gaps in addressing different components there. The survey and the application process was created. This is going to be the third installment. In the first year was sort of the pilots and figured out a few of those kinks. And now we're in a great place now where we've continued to work very closely with the Leapfrog Group and thinking through the different components there and ensuring that it matches where we need to be. And we're measuring the progress of that too, with some of the insights too as well that my friend Leo shared earlier on who has been impacted. But we're also exploring how do we continue to support sustaining this. I earlier talked about our work in the advocacy space and our work with other national partners as well. And so we're exploring all of these components to ensure that these changes and all of this effort can be sustained, not just in your local system, but you will have the wraparound support to sustain those changes you're making. So we're moving our standards to practice. This program helps us do that. I know many of the leaders on the call want the best standards to also become routine practice as well in your system, like Chris will share. And participating in this, going through the process, working with your team to answer the critical questions and thinking about what care looks like locally for your system today helps in achieving this vision of taking those standards and all the evidence and all the research that's gone into that and making that the reality. And we welcome you all to consider this. And I think I just have one more slide. And if you have specific questions, so you can move on to the last slide for me before I pass this on. I think back to you, probably to Chris, but my last slide, it's how you can reach out to our team, quality@diabetes.org, and our team members will be more than happy to answer questions about the Leapfrog program and our partnership and other ways we can support you on your quality and patient safety journey. Thank you.
Thank you. And now our winner, our recognized leader.
I think our community is actually the winner here because
Yes.
following these standards and achieving this goal really improved care throughout our organization and out through the community, and really set a gold standard to the care and the type of culture we have here at Shore Medical Center, which is to improve patient safety outcomes and our patient experience. And thank you for this program, because it helps so many people in their lives in the hospital and outside the hospital and their day-to-day. Next slide. So I just wanted to give everyone just a little idea of our journey and how we proceeded with getting this esteemed recognition. We've participated in the Leapfrog safety survey for about 20 years, I would say. Long time. It's the gold standard in our organization, and we strive for that every 6 months. And it's a great outline of where we're going, where we want to be, and we use it in our day-to-day. We use it through our board, and we announce it and educate our community with it. So when we saw that Leapfrog expanded to this prestige recognition for caring for people with diabetes, we were excited about this. We really wanted to get on this journey and improve our patient care. So it was very exciting for us. When you first see the application and you take a look at it, it can be overwhelming. There's a lot of ins and outs to the application, though it's the standards, but put in a survey format, it still can be a little overbearing. But if you step back and you think about it, most of you are already doing a lot of what the survey expects you to do. And that's what we at Shore Medical Center found, that when we looked at that survey, we found that we actually already were doing a lot of these things for our patients in our community. And it was really fine-tuning and adding a couple of extra things to get us going. So here at Shore, we're committed to providing the highest standard of care for our patients and the patients that are navigating the complexities of diabetes management. And like I said, you're probably doing more than you know. When we got together, we did a comprehensive gap analysis with the survey just to see where we were and where we wanted to go. And what we found is that we were doing more than we thought we were, but there was ways that we could improve, which is exciting for us. So we used the gap analysis to actually kind of make a roadmap to set us from where we were and where we wanted to go. So we kind of had a plan, and we presented it to our board and our executive team, and got an executive sponsor to sponsor us and support us in this exciting journey that we were about to take on. what we found is some of the things that we needed to improve is our standardized pre-op diabetes medication instructions and A1C testing in our surgical candidates, and then improve our discharge instructions. That was one of our opportunities. And here at Shore, we welcome opportunities because every step forward we take really benefits our community, our patients, and we're a small community hospital, so it touches our family, and we really take pride in what we do. With we also really liked how we were giving patients back some independence by creating protocols and roadmaps for using the pumps that some patients have. So when you enter a hospital, you're pretty much stripped of your independence, and giving some of that back empowers a patient, gives them a say in their care, and that's the goal here. Like, who knows the patient better than the patient themselves and their family? So we want to make sure everybody had a voice in this. Next slide. So when we were still working through getting this together and creating our project plan, we mentioned this to, we had a Joint Commission survey. And in our quality session, we mentioned that we were going to go for this recognition. And in our organization, we were already testing our joint patients, hip and knee joint patients, and our spine patients for diabetes. As you all probably know, if your diabetes is managed, you have a better chance of a better outcome. So improving outcomes, improving healing for the patients is really a good way to look at this, and it really has helped our orthopedic patients in our organization. Well, the surveyor was so impressed. She said, well, you should do that for everybody. So right there, we had the Regulatory Joint Commission supporting our journey in this, which of course, fast forwarded us into taking on this esteem journey that we were trying to achieve. So that was very exciting for us. And so we expanded the practice, of course, to all surgical patients. But not only did we do that, because we never do something just a little bit, we always have to take it the next step. We test now everybody in our organization, inpatients, outpatients, patients that come for endoscopy procedures. Anybody who hasn't had an A1C in the last 3 months, we test them and we give them an A1C test. Surprisingly enough, you have people out there who actually have diabetes and they don't know it. They may have felt tired, think, oh, well, it's just, I didn't get enough sleep last night or whatnot. But actually, they're walking around with diabetes. So we have found that doing this, we can defer, not cancel surgeries. We can just defer the surgery so we can get their diabetes managed, get them with our educator so they're in a better place. Make sure their nutrition as well. Get them in a better place so when they do have that surgery, they're going to have a great outcome. We've taken care of the whole patient in every aspect of their disease processes. So that was very exciting for us. So we had to kick it up a notch. So how did we start? So after we did the gap analysis and we got the project plan and we had our CMO, Dr. Galler, fully support us without hesitation. He was great with getting this started. The first thing we did was we pulled together a whole multidisciplinary team. And why did we do that? Because if you think of it and you read the survey, you'll know that the survey and the criteria in the survey and treating a patient, every patient touches every area of your organization. You have nutrition services, you have the social workers, dietitians, you have the pharmacists. You can't forget about the information technology department. You have the nurses, you have the quality department. everybody really is involved in that patient's care. So you need to pull all those people together to get to the root cause and find out how the puzzle is going to fit together. This affects this and this affects that. So everybody has to be in the room and have a voice so we can make it all flow. We want it embedded in our care processes. We don't just want to create a process and have it on a piece of paper. We want it to be the way of our day-to-day activities with our patients. So it's very important to build that multidisciplinary team, get that gap analysis, and have that roadmap or project plan to let you know where you are and where you want to go. And like I said, you will find that you are actually doing more than you think you are, which is very exciting, and it really reinforces the good care that we all give. And that's why we got into healthcare, right? We got into healthcare to take care of people. So it's very exciting when that is reinforced, that you are already doing a lot of the best practices needed. Then we reviewed a lot of policies and procedures. There are a lot of policies and procedures and requirements that you would want to implement. And what we found is a lot of our policies and procedures were in place. They probably just needed some fine tuning. So, and we did indeed fine tune about 30 policies in our journey, and some of them had to be vetted up through MEC and to the board for approvals. The other thing is when you're improving, I hope I'm not talking too fast, when you're improving your policies and you're changing your processes, the information technology department really needs to play a part in this, because where's our medical record? It is electronic. So you want your electronic medical record to match the processes, the protocols, and have everything streamlined. So everything is gives you like direction in the EMR to get where you're going with your patients, follow through with your protocols and your processes. So they were a key part in our journey, because if it's not documented, it's not done. I think most healthcare people know that whole saying. So giving us a place to document, and the best place to reduce the amount of extra work we put on for the doctors and the clinicians to use in the EMR, because we don't want them in the computer all day. Where do we want them? We want them with our patients. We want them talking to our patients, interacting, educating our patients, and giving the patient the best experience they can possibly have when you're in the hospital, because you never forget those visits when you're in the hospital. That's one thing that stays with you forever. You could say, I remember 10 years ago when I was in this hospital, and most people do. They remember every time. So one of the big things is to streamline the processes and procedures across the hospital and through the EMR. Next slide. Patient education was another cornerstone in our plan. We have certified diabetes educator. I believe we're just bringing another one on, and I'll tell you why in just a second. Because we wanted to give our patients one-on-one educational sessions. When you are told, and you're in the hospital and you are told you have diabetes, it just sets your mind in motion and all the things that you've heard. But to have somebody with knowledge, with experience, to simplify how to take care of your diabetes is so imperative for a patient. And it also, if they are educated, it also makes them more compliant, because it's not as scary to take care of your diabetes as you may see on a TV show. So you really want that one-on-one personalized patient education. Plus, every patient is unique and every patient is different. Their family dynamic is different. So you really want to personalize it to what the patient needs, which is very important. In addition, you can't give somebody the diagnosis of diabetes and then just, discharge them. What happens after they leave the hospital? That is something, and it's all included in this survey, which it was really heartwarming to see that what are they going to do when they leave? So we all know that there are social needs with our patients, and everybody has a different dynamic. So some patients may need help with their medications. Some people may not have access to nutritional food. So we screen every patient for social determinants of health, or as Joint Commission calls it, health-related social needs. We screen every single patient that comes through our doors to look at those gaps that may affect them when they get home and bring them back to the hospital. We want them to be able to leave with their toolkit to be able to take care of themselves when they get home. So we screen every patient for their social needs. And if they have, no shelter, if they have medication needs, if they have nutrition needs, then we can set them up with community resources or in-house educators to get them the best path to be successful after they leave the hospital. So we found that that was very important to do with our patients. And we screen our diabetes patients, but we screen every patient. A lot of what you do with your diabetes and protocols and processes through this program, really you can actually send out to other disease processes, because screening patients for social needs, that can affect any diagnosis. But so this is a nice roadmap to improve care throughout your whole organization and those diabetes patients. What we found when we implemented and achieved this wonderful recognition, what we found is that 25% of our patients have either a history of diabetes or are newly diagnosed with diabetes. So if you think of that, 25% of our population that are inpatients here have some kind of relation with diabetes, new or a history of. So when we implemented this program, we were helping and improving care to a quarter of our patients across the board. We get better outcomes. We get less pressure ulcers. We have better healing rates post-op surgeries. We have better management, less readmissions. So this program is essential for caring for the patient with diabetes, but it's also a roadmap to care for this whole patient that we all chose to be in this profession to do. So what do I think is important? What was our key turning points to make this a successful journey for Shore Medical Center? One, our culture of safety. Doing that Leapfrog safety survey and getting that grade every 6 months, we're constantly thinking about safety. We're constantly thinking, how can we improve? What can we improve? But we can't do it alone. One person cannot improve care for everybody in the organization. So you really need to have a collaborative approach. You need to have a multidisciplinary approach, and you really need to have a team get together and use a teamwork approach. Everyone needs to be fully engaged. As we just heard, these regulations or everything's being improved every year. So everything's changing. Medicine is changing faster than we can keep up with. So you need to stay fully engaged and actively participate in discussions and care plans, and keep an eye out for what's new and what's coming. And we are very lucky that the Leapfrog group and the ADA are working together to help us do that. So we don't have to go looking. We have a great team partnership here that is guiding us and helping us improve care and keeping up with the changing times of medicine. Diabetes treatment is changing so rapidly, it's very hard to keep up with. And then as meds change, you really have to look at well, how does this affect if someone's having surgery? How does this affect if someone's going home? Do they know how to use these tools? So that was very important. Um, and then a nice team structure helped us ensure accountability for this continuous quality improvement initiative that we took on. So I am really grateful that we had the opportunity to take this survey, and believe me, you will see our survey again. Next slide. This is just our press release. We were very proud to receive this recognition, and we wanted to share it with the community. We wanted to open the doors. One of the other things that reading this that just dawned on me is we started having workshops outside of our hospital to educate the community on diabetes, let them ask questions, get them more prepared. So we announced this, and we were very proud to achieve this wonderful recognition, and we're going to keep going and keep getting better. So thank you very much for having us.
Congratulations.
Thank you.
Wonderful.
Well, thanks so much, Chris. That was honestly really inspirational and comprehensive. I mean, I think you've given a really great overview of it, exactly what it takes to get the recognition. And to Chris's point, right at the start there, I mean, it certainly can feel overwhelming. I think just at first, kind of being greeted with the full heft of the application. A lot like the hospital survey, of course. It's a long document. It's a comprehensive document. There are a lot of aspects of patient safety and of the ADA guidelines that are really important priorities for us. But I want to take just a few minutes here to walk through some of the specifics of the program and exactly how you can go about applying. If you're feeling like me, you're feeling really inspired and motivated, and you want to know what to do next. So just a couple of key things here. So the application is really a few different parts. So there is a part where you report data on your policies and procedures, and even collect some samples. Go through some randomly sampled patient records to measure your own adherence to policies. But we also bring in your safety grade. And your scores on the hospital survey measures on the CPOE and BCMA measures, right? And so now all this goes into what we're currently accepting, which is the applications for the 2026 Recognized Leader Program, the application of which is due January 31st. And we'll announce that third class of recognized leaders in June of 2026. So there's some time away, but that means, the next few months are a good opportunity to get together as teams and start thinking about how to prepare that application. I should say too that, and this is really important for this program, only the top performers, only those that are recognized, are publicly reported. If you apply and aren't recognized, there's an aspect that you aren't implementing yet, or maybe there's something in your safety grade or survey changes or something. We don't report any of that publicly. We don't report any details even on the application. It's really just you apply, and if you earn the recognition, we publicly report that. Otherwise, we don't report anything else. And that's because to the point about what we're asking here, where we realize we're setting a really high bar. And so we want to, encourage you in sort of a safer way to think about this program as something to really aspire to try for. And then, if you identify areas where you're falling short, to work on those and apply in a subsequent year. I just want to take a quick moment to flash up some of the names of our fairly illustrious expert panel for a moment that we worked together with ADA to bring these folks together. You'll see that we selected for a broad range of clinical specialties, nursing, pharmacy, endocrinology, but emergency medicine and surgery too, bringing all those specialties together. And I think you see that reflected in the application, how many different areas of care we're covering. But as well as, I want to point this out, to patients. People living with diabetes who had recently, unfortunately, spent a fair amount of time in the hospital and who had a lot to contribute in terms of how we thought about the structures we were setting up. All right, so now let's just talk about a few of the areas of quality of care that we're going to capture here. So starting with our structural measures. So we're looking to maximize, as Chris said, patient autonomy in the hospital, right? Let folks self-manage their condition when it's safe for them to do so. We're also looking for hospitals to have established hypoglycemia protocols so that nurses can immediately act in an emergency. Now, thinking then of surgical patients, preparing patients with surgeries, just like Chris said, right? Deferring, not canceling, finding ways to make sure that procedure can go ahead, but go ahead safely. So we're looking to see that preoperative assessment of blood glucose, the medication management in advance of the procedure, right? And then monitoring during the procedure. So this is one of those indicators where we'll ask you to randomly sample 30 patients that had a surgery, patients with diabetes, and evaluate your adherence to your own policies just by looking at what's documented in the patient's electronic health record. So now going beyond surgical patients, thinking about all hospitalized patients who have diabetes, that HbA1c testing um, on admission unless a recent test is available. And then one really key area of focus for us, and this came for the guidelines, but this came from the patients too, right? Is thinking about how meals and insulin administration is done. We want to see a few different things, right? But some policies and procedures to make sure that blood glucose is really being monitored around meal times, that food consumption is documented, that patients are given information about the carbohydrate content and can so they can kind of participate in their own care there with something as simple as thinking about their meal and how that fits in with their insulin administration. And now then turning to higher risk patients with diabetes, right? So these are patients that are admitted for a serious complication due to their diabetes. So maybe they're admitted for diabetic ketoacidosis, so something like that. Or also patients with an HbA1c above 9.0, we consider those to be high risk. And so here we're looking for hospitals to do a couple different things. So first to deploy specialized care teams, right? So to care for that person with diabetes, but also to educate them on managing their condition. We're really concerned also with the discharge planning process. I'd say this discharge planning is the single most kind of comprehensive indicator we have. But again, you'll find that reflected in the guidelines. We are going to ask you to sample 30 patient records to ensure that you're doing a variety of different really important things like referrals, to making sure that care coordination is happening, making sure that the patient was given appropriate education based on their care plan, right? So maybe how to use sharps, things like that. A lot of times someone admitted to the hospital with diabetic ketoacidosis, that might be the first time they've just been diagnosed with diabetes. They need a lot of education to know how to manage their condition independently in the community. And then, other things like medication management, a follow-up phone call that, we'd want to see for every patient, but they're so important for people with diabetes, where the stakes couldn't be higher, really.
Mhm.
So just a few steps to submit the application. So, we'll ask you to sort of read through it, get a sense of where you are, start to do that sampling of patients. We have a workbook that you can use to help guide that sampling process and to evaluate your progress there. And then just from your hospital survey dashboard, where you're used to submitting that hospital survey every year, you can access that application, start to enter the information electronically. And so, as I said, these slides will be posted, so you'll have access to the links there. So a couple pieces that'll just take you right there. So now January 31st is our application deadline. That said, we do encourage you, to get started as soon as you feel like you're able, but also to reach out to our help desk, right? And let us know, it could be you're reading some specifications, you've got a question about exactly how to interpret something the exact same way it works on the hospital survey or with the safety grade, we'll be able to give you, we strive for a same day response, right? To get right back to you and to help kind of guide your effort there. So certainly we're really eager to take those questions and, um, you know, this is obvious, but the sooner that you ask the question, we can start to work on that. The better off you'll be in terms of your application, but that helps us a lot too, frankly. In terms of the design of the application. So there are no stupid questions. If you're asking, it means that we could have been clear on how we wrote the specification. So we really appreciate all that feedback there. And with that, I want to make sure that we have enough time for questions here. We have just a few minutes, so I'll just quickly glance through the chat. Okay, so I do see one so yes, so these slides will be posted, and actually a recording will be posted as well. So you can re-listen to the different portions there. And I do want to not miss that actually, I think we had yes, Dr. Ebikozian answered a question earlier about having work groups to work through these issues. So that's ADA is and I was helping out a little bit. ADA is thinking hard about what it would look like to have a good quality collaborative around there, and so we'll have more to share about that later. But I think you're absolutely right. Hospitals working together is an excellent way to make some progress here. Um, and then the other question is this program for individual healthcare professionals or for hospitals? So as we structured it here, yes, the program is for hospitals. That said, if you practice at all in a hospital or wherever practice there, you couldn't hurt to reach out to them and try to think about how to maybe work together on there's a lot of work to do, as Chris kind of walked you through there, in terms of thinking about how to update policies, how to make a lot of that care coordination happen. That's something that I think even beyond the four walls of the hospital, right, the whole kind of community of healthcare professionals can participate in and help make possible. All right, so I want to just see if there are any other questions that folks want to ask either in the Q&A, or I don't see any raised hands at the moment.
I just want to say a friend of our family in his 40s with diabetes was misdiagnosed with a leg injury, and that led over time to his amputation of half of his leg. This does happen, and it was avoidable. And so I have seen firsthand just how devastating it can be. So I'm very inspired by hearing Chris, your story and your hospital story, and your persistence in making sure you're doing the very, very best thing. So, and I thank everyone who's participated and our colleagues at ADA who've just been extraordinary in really carrying the torch for this incredibly important issue. And we're just very pleased to be able to partner and to then learn from hospitals like Chris's hospital and Chris herself on what it really can mean in the real world to people. People's lives are truly altered by this. So thank you for all of that.
Excellent. And I do see Diana has raised her hand. So Diana, I've invited you to unmute yourself. Please go ahead. Oh, and actually, I'm sorry. I also see you put a note in the Q&A. So no, there is no fee to apply. It's actually like any other Leapfrog program. There's no fee to participate. There's no fee either for asking questions with the help desk or anything like that. So you just please feel free.
And yes, we're posting this webinar online.
Mm-hmm.
It's a question. So I believe we are at time, John-Luc.
Yes, that is true. And I don't see any other questions. So, well, thank you so much, everyone, for joining us, and certainly let us know if you have any kind of follow-up questions. And otherwise, thank you so much to my panelists here for walking through the different aspects of this really important program.
My pleasure.
Thank you, everyone.